Welcome, everybody. I just wanted to introduce myself first. My name is Jennifer Brown. I'm a reporter and co-founder of the Colorado Sun. My co-host of this panel, unfortunately, has COVID, so bear with me as I wing it by myself. Thank you so much for coming to Sunfest. This has been a dream of ours for 5 years since we started. It's part of our mission to convene community engagement and to be a new kind of news source that has more interaction with our readers, not just our newsmakers. So this, of course, fits that bill, bringing us all together here to have a very important discussion about a topic that's on all of our minds, especially the last few years. And of course, we're here to talk about homelessness in Denver and in our state. And just to share a few statistics with you to kick us off, Denver's homeless population grew by more than 30% over the last year. On a given night in January, when the population is counted, there were more than 9,000 people living outside or in shelters in the 7-county area. Also, the number of deaths of people who are homeless has increased by more than 50% in a year, and that's according to numbers from the Denver Medical Examiner. And a lot of those deaths have been attributed to the fentanyl epidemic that we're experiencing. And you may recall that on his very first full day in office, our new mayor, Mike Johnston, declared homelessness a state of emergency. He has vowed to house 1,000 people by the end of the year. I think the city council is in discussions about spending, the recent price tag is like $15 million on finding that housing. And, at the Colorado Sun and at my time at the Denver Post, we've covered so many stories about the solutions and programs that are working to get people into housing and to prevent homelessness. The one I always come back to that seems to work so well is called the Social Impact Bond, which many of you may have heard of. But this is where agencies actually send people out onto the streets and locate specific people whose names are on a list, and these are people that often end up in the ER or in detox or in jail, and frequent users of the services, and they actually offer them housing. This has been a super successful program that we'll talk about more. So to help us get through this conversation, we have these 4 awesome panelists with us today. First, we have Britta Fisher. She is the CEO of the Colorado Coalition for the Homeless. The coalition has 21 supportive housing and affordable housing properties for residential in the area. They also operate the state-of-the-art Stout Street Health Clinic in downtown. We have Milagros Barsallo Rubio. She's the director of public engagement at the city of Denver, which, as I mentioned, is working to create affordable housing every day and has homelessness at the forefront of the mayor's agenda right now. We have Dr. Jamie Rife. She's executive director of the Metro Denver Homeless Initiative, which, among other things, is the agency that coordinates that point-in-time survey in January that I talked of, where all of the volunteers and members from nonprofits across the area go out throughout Denver to the suburbs, and they try to count every person who is not housed on a given night in January. They do this every year, and it's really the best and kind of only data we can get about how many people are living outside and in shelters. And finally, we have Anna Gloom. She's a member of the Housekeys Action Network in Denver, which we call HANDS. And Anna has 10 years of lived experience being homeless in Denver that she's going to speak to us about. So first, I'll kick it off. Maybe we just want to go down the row, whoever wants to answer this question. But, we have seen homelessness on the rise. The numbers show it, but it's also been very visible since 2020. We can see that our city is filled with so many tents on sidewalks and the safe outdoor spaces, and it's something that people are really noticing right now. So I want to ask, why is that? Why is homelessness on the rise? Why is it so visible? And we have these programs that are working, but they cannot help everyone. So why is that, Britta?
All right, thank you, and thanks for being here. Again, I'm Britta. Sure, we can slide that over. I think it's a great question, and it's one that I get a lot. Is the Colorado Coalition for the Homeless, we've been working on this issue for 39 years, and we still see people experiencing homelessness. And it's because of what are the root causes of homelessness. And ultimately, for most folks, there's lots of individual stories, but the big themes are that housing's too unaffordable, that they can't pay their rent or mortgage on the income that they have. And we also see people who have had broken households and families and relationships and disconnection. And those two things seem to always be at the top of the things that we hear. But fundamentally, I think it's systemic that we have had housing that has been excluded from people. It's been exclusionary housing, primarily on a basis of race. And we've also not had enough affordable housing. And that's what's dramatically changed in this last decade. When I worked at the Colorado Coalition for the Homeless in the early 2000s, we were the 18th least affordable state in the country. Today, Colorado is the 8th least affordable state. So that means we are one of the most expensive places where the housing wage is now more than $32 an hour. There are a lot of jobs that pay less than $32 an hour, and people are having trouble making rent. And we have all sorts of different individual narratives, but those themes and that system that has excluded housing and that it's too high of a cost is fundamentally what we see. When you look at which cities have the most homelessness, it is cities that have high rents compared to the incomes and low vacancies. That is statistically and data-driven why we have more homelessness in Denver, where you have to pay more than $2,000 for rent, versus like a West Virginia, where you're paying hundreds of dollars for rent.
Thank you. Millie, or anyone else want to tackle that?
Are we going to We don't know the process yet.
Yeah,
Yeah, go ahead. You go ahead.
Everyone's so polite over there. Just take it.
Yeah. No, sure. I think my first point was also affordability has gone down, and I think at the same time we're in a post-pandemic mental health crisis that people are facing. Obviously, not being able to afford a home contributes to that, and other things that come along with that, substance misuse, and I think coming out of the pandemic, we see organizations that do this work like CCH, like MDHI, like all of our incredible service providers have been working so hard through the pandemic, and we see needs continue and to become more acute with the statistics that you shared with homelessness going up, but we also see funding drying up, and we see people on the street that need more support and more support and more support, and we have a kind of recession of resources in that. So that's another reason that we're seeing this, I think. Yeah, that's what I would add.
Hi, everybody. Yeah, ditto and ditto. I think I want to add just a couple of things. So when we look at the data, so Metro Denver Homeless Initiative, yes, we do the point in time, which is a great one-night snapshot. The other thing we have is the Homeless Management Information System, and that allows us to capture data on every single day of the year with thousands of people out there doing the work. So what we see on a single night is, yes, there are over 9,000 people experiencing homelessness some point in the last 10 days of January, but what we see in the course of the year is that we have about 28,000 people that at some point during that year touch and interact with an agency that is using the homeless management information system. So we're getting to a point where we don't have to necessarily rely on that one-night snapshot, but we have more real-time data to understand the issue. But no matter what data we're looking at, there's always consistencies. And one of them is the highest, everyone talks about economic conditions being the highest reasons why they are experiencing homelessness. It's not being able to afford housing, they were evicted or asked to leave, it's underemployed or unemployed, it's family relationships, things like that. I think the other thing, you cannot talk about homelessness without talking about race in this country. They're absolutely tied together. Homelessness is not in and of itself the issue, it is the fallout from other failing systems that disproportionately affect Black, Indigenous, and people of color. So our education systems, our healthcare systems, our criminal justice system, child welfare. If we look at the data, people are coming into homelessness directly from those systems, which disproportionately affect people of color in this country. And so at the core, yes, homelessness is an issue, but it's really fallout from so many other systems that are failing, and specifically failing people that are Black, Indigenous, and people of color.
Okay, sorry. My name is Anna. I could go on for hours on this. This is such a large subject. First, what all three of the other panel members are saying are true. Yes, housing's unaffordable. I mean, it's systemic racism. The reason I believe Colorado specifically at the rate it's going is raising so fast is that I have to say we're wrong on the number of vacancies being low, because we do have a lot of vacant apartments here, but one of the biggest issues is no one can afford them. So it's like, you can go find an apartment, you can look at a building, it's got 40 apartments in it, but you're looking at, oh, okay, I don't make 2 times the rent, I don't have the deposit first month, last month, oh, there's the fee for the application, there's this, there's that. I mean, the long run, let alone if your credit's bad, God forbid, there's constant discrimination based on race, based on sexuality and gender identity, voucher recipients, extreme amounts of discrimination when you have a voucher and try to rent an apartment. But I also want to say is that when we look at houselessness, it is full on a systemic societal issue. Most people become houseless because in the long run, society has put the whole idea of pull yourself up by the bootstraps, work for yourself, you can do it, but they give us nothing to do it. So sooner or later, you finally fall into being houseless because you've worked and worked and worked and things just never change, and next thing you know, you've lost your rent. And a small part of it is also mental illness and drug abuse. But the most of the people who are drug abusers on the streets and have a lot of mental illness that wasn't before when they were housed is due to being on the streets. I do want that to be a narrative that needs to be understood. Most people who end up on the streets were not drug addicts when they came out onto the streets, but the pressures of being out there has done it. So that narrative that, oh, they're just drug addicts, that's not why they're houseless. It's a small percentage of people who were drug addicts. I myself I'm a recovering addict. And yes, most of them do end up losing their housing, but they already have a leg up on the houseless community. That's all I can think of for the moment. Sorry.
Thank you. That's a good segue on into a question I wanted to ask you guys about housing first. So when I started writing about homelessness, probably 15 years ago or something, when I was at the Denver Post, housing first was the buzzword. Like, everyone talked about that term, and what it means is if someone has mental health issues, has drug addiction issues, better to get them in housing first, provide those services, maybe by some people who live in the building, instead of requiring people to get treatment before they get a place to live. It seems like there's at least some talk of that shifting, and I'm curious of your thoughts. Maybe Anna, you could start with that one.
Okay. Regarding, could you ask that one quick more time? So.
Basically, I'm asking, do you think that people should get housing first and then
Okay,
treatment,
thank you.
or the other way around?
No, I genuinely believe in a full-on housing first approach. We need to, the root cause of the drug problem for them usually is the houselessness. So by putting them in a home, and I'm not talking, they shouldn't be drug tested for these homes at all, because as an addict, I will tell you now, you cannot force an addict to quit. Does not matter what you do to them, throw them in prison, nothing. An addict will be an addict till they are prepared to quit. But putting them in housing and then giving them housing that has the wraparound services that they need to get them the things that they need, their mental health service, the drug addiction counseling when they're ready for it, helping getting food, helping getting the skills that they may have never even gotten because they have lived a whole life. They don't know how to use the internet correctly, how to pay bills online, all of these things. Once you do that, most people, when your life gets better, the drugs, that's kind of the next thing because you don't want that anymore. You're not trying to escape. Most drug use is escapism. So when you finally have a lot of the stuff that you're escaping being addressed, you'll stop doing the drugs. And this goes for alcohol too, which I also, again, another issue that I do have a problem with is that yes, we speak of drugs, but we do forget that alcohol is a drug that's very destructive and is also the most easily accessible drug in this country. And it ruins people, and a lot of people on the streets are houseless because not just because of fentanyl and methamphetamines and cocaine use, but also alcohol. So I truly do believe housing first is the absolute best method for everyone, even for people with mental illness, for every single person on the streets. Putting them in housing and giving them the services is what will make them flourish and make them be able to be a contributing citizen to society in a possible way that they can.
Yeah, just to piggyback off what Anna just said, a couple of things. Number one, you just talked about the SIB project, the Social Impact Bond, right? That's 86% effective, is what we know. And so housing first, so there's been some narrative out there that just means put people on housing. And we've done it, and that's not what we're saying. When we say housing first, we say housing first with wraparound services, the services that people need. And that's truly housing first. It is by far the most successful way to get people on a long-term path to housing stability. Treatment first, on the other hand, is somewhere in the 30%. So we have housing first, over 80% effective. We have treatment first, which is in the low 30s.
If I could just point out,
Yeah.
I'm proof of it. I went to treatment for 6 months, went right back to the streets, just for proof of that.
Thank you. And so I think the narrative for some reason has shifted to it's housing only. It's not housing only, it's housing first so that people can stabilize and then be able to address any other barriers that they have. And so it's by and large, like I said, the most effective practice out there, and it's also much less expensive than having people languish in homelessness. Like it's fiscally the most appropriate thing to do as well. It's much cheaper to put people in housing, have the services, than it is to allow them to continue to hit all these different systems that they do if they are spending that year outdoors or in the system. So it's fiscally the right thing to do, it is morally the right thing to do, and it is, from a data perspective, the most effective thing to do.
Good for the budget, good for humans. Why do we keep talking about it? Because there is this counter narrative. So I just want to speak to that for a moment. And the Colorado Coalition for the Homeless started as a small clinic to treat people who were living outside. And what they found very quickly, those early clinicians tasked with that work, was that what they wished they could prescribe was housing. That they would treat someone's wounds, they would treat someone's disease, but inevitably, if that person was still living outside or even in our shelters, their health conditions would deteriorate, and they would keep coming back with things that would otherwise be solvable if they simply had a safe, decent place to live. And so that is why the Colorado Coalition for the Homeless is the largest provider of supportive housing in both the state and in our city here in Denver. And we have seen that you can treat with primary health, behavioral health, all sorts of health care, but if housing is not part of the treatment, it is not as effective. And that's what the social impact bond for supportive housing said. The treatment group got housing, and they were remarkably successful. So why haven't we done it all if we know this is the answer? Well, it takes scale. The scale to have the financing for affordable homes. But most of the products that have been created by our legislature or Congress are across the spectrum, and we need across the spectrum solutions. But it takes deep subsidy to do at the affordable level for people exiting homelessness with very low income. The hand survey is a great example that says if they just had a place where they could afford for a few $100, then that they could be housed. And that's true across the country. But it's also happened in other countries. Internationally, supportive housing is the thing that works. Finland is a great example that they used their lottery and some other financing to really dramatically increase their supportive housing stock over the last more than a decade. And they have seen now that their homelessness unsheltered is barely there, and the system for emergency sheltering can work, because when you have a place on the other side of it, then all these systems work better for crisis intervention. So yes, housing first, housing plus services plus healthcare really works.
I have another question for you, Millie, if that's okay. Since you work at the city, let's talk a little bit more about the mayor's plan to house 1,000 people by the end of the year.
Can I say one thing? That is,
Sure.
I just want to put this out. I'm sorry, but can we stop calling it housing 1,000 people? You guys are sheltering them.
Well, that's what I was going to say.
It's shelter. It's not housing.
Right. This plan calls for placing people in what they call pallet shelters. Maybe you could explain what those are, because I'm not sure I know. The ice fishing tents that we have seen in the safe outdoors spaces that the city runs. And also, I think, old hotels and motels that have been remodeled to become housing for people who are living outside. So there's been some criticism of those options. Maybe describe what the plan is and address those criticisms.
Sure. Yeah, and thank you for sharing your perspective, Anna. I know you're actively engaged with us as well. So, so thank you for the question. So, I am obviously invested in this work. As these folks know, I'm part of the team that is working to make this plan a success. So, on his first day in office, as you mentioned, Mayor Johnston declared a state of emergency on homelessness. You shared some of the stats, but the point-in-time count showed that we have over 1,400 people in our city experiencing unsheltered homelessness, and the goal of House 1,000, one of the primary goals, is to support 1,000 people to get indoors by the end of the year. We are doing that by connecting them to resources like micro communities, which include tiny home villages and pallet shelters, which are prefabricated units, and hotel conversions, and then connecting them to housing resources like leased units, primitive supportive housing. And the work of this initiative then also includes identifying ways to increase the housing stock through existing resources and expediting other options that could be coming online quicker by increasing the timeline, or increasing the way that things flow through our permitting timelines in quicker ways. So we are doing that work of finding housing units. as we're bringing people into our temporary communities. So that's the sort of long and short of the initiative. We are, our main goal though is to make sure that people are not experiencing unsheltered homelessness. That's we're heading into winter, and we know that people, I don't have to tell anyone on this stage, and probably most people in this room who are doing this work, that people are in danger, as Anna has shared some of her experience, and we're in a crisis. We need to reduce the number of people on the street. So right now, we're working first to get that number down, and then Britta shared some of the challenges. Like, we need to have options on the other end to connect them to, so that's the other piece of this initiative. Surging the housing stock so that we have somewhere to connect them once we have them in a micro community or a hotel conversion. There are no tents, there's no in this initiative, so just wanted to clarify that as well.
Thank you. Anna?
Sure. Yeah. So, I mean, first, the point in time count, which I understand, is still a very low number. It isn't, and I mean, everybody can agree with that. That is not the actual number, but you can only do so much. The city, and thank God, Denver's not even that big of a city comparatively. So my Mayor Johnston first saying he's only going to do 1,000, that's nothing. That's a speck. That's a drop of that. Let alone, I can put it this way. We, at the Houseless Advisory meeting on last Friday, we had a representative from DHA because the lottery had opened for the DHA vouchers. These DHA vouchers, at that time, she had 16,000 people signed up on the lottery with 8 hours to go for somewhere between, I believe she said, 645 to 1,000 vouchers. 1,000 vouchers for 16,000 and counting. Go ahead, yes.
And that count got up to over 30,000.
Figured. One of the things that HAND has put out multiple times is master leasing. We have 23,000, last time I had heard, and again, these are just statistics I've heard in the last couple of months, things do change, but we had 23,000 vacant units. We have the office towers, I understand, that's a whole litany of problems, but 23,000 vacant units in the city. This is a simple plan of taking the money, finding the landlords. The landlords get their money from the city by the city permanently, or even I've said an idea would be is to temporarily lease these apartments while the city builds the housing for these people. Put the people in knowing that they will be moved to a new housing unit when they're fully finished and built, and giving the unit back to the landlord and letting the landlord, as much as I'm not even going to go into how I feel about it, do as they please with it, which is ridiculous. But this way we get we can get people off the streets. As also another one for Mayor, this initiative, we have some major issues with this House 1,000. First off, it's a feeling of it's more visible, not vulnerable. When the first one that just happened on 8th and Logan, we had people who, because they happened to not be at the camp, and we have heard stories of, yes, that people were moving from other camps there, and I understand the capping, but people that had been there forever weren't there because they were at work. They didn't get a hotel room. A woman with a colostomy bag was left standing on the side, and God forbid, I do not want to even go into how, what happened. I want to ask one quick question. What happened to you guys saying that you were going to do anywhere between 20 and 30 days for these cleanups? Like 6 days? You guys, you're dropping the ball already, and I'm not trying to be rude. I'm just letting you know the way it's feeling among the advocates is that you guys aren't doing this the way first you said you do it and the way it should be done. I mean, first, again, 1,000 suspect. Two, you have people who are on the streets that if you took the people who have been in the shelters for upwards of 10 years, I'm not kidding, people who have been in those places for 10 years, elderly people and sick people, move them into the hotel rooms. You open shelter space, which God forbid, another issue right there is that we need to be really, really doing more about what the shelter conditions are, because they're deplorable in this city. It's another reason that you see when people wonder why they don't go to the shelters, they're deplorable, utterly deplorable. But I'm just saying we could do this a better way. But I just feel like, and most of the advocates I believe could agree with me, this is not being done correctly at all. It's just feeling like we're just appeasing, the city's just appeasing the rich and the tourism and the businesses, not looking at it from a true humanitarian experience. Yeah.
Millie.
Sorry, can you hear me okay? Yeah, so we know that 1,000 is not everyone. We know, we have heard a lot, and I have learned a lot from Jamie about the point in time count. We know that this is a drop in the bucket, and also we have to start somewhere. Like, we can't just leave people on the street. So we're really glad to be in conversation with experts and people experiencing homelessness. But like I said, we have to start somewhere. It's important to us that we are doing something and starting with a plan and getting feedback from all of you, right? In terms of the first encampment resolution that we had on Monday, right, the first move that we had, and the process leading up to that, we worked with our outreach teams, and those teams are, you know, experts at what they do. These are not new outreach teams that came with this initiative. They are folks that have been in the city that have been working on outreach, and following their lead and their process. We are, you know, looking, this is new. We're kind of implementing this process as we go, and we're looking at how we building lists to make sure that as our outreach workers who are experts at building relationships and maintaining relationships as folks move from different camps, they, you know, might go to one area of the city, they might go to a shelter, they might come out of the shelter. As our outreach workers keep in contact with them, we know how to build out our lists as we're increasing the units that we're bringing online, but we're learning from them. I know that we had Angel from Hand there on Monday, and she was supporting us to keep track of the people that weren't on that list as well. So this is definitely a learning process for us too.
Well, I also want to say one other problem with these shelters. Again, I'm really, really tired of us saying that we're housing people. We're not. We are sheltering. I stayed in one of these hotels when they were COVID respite hotels. I can tell you, the way that these are being run, you're setting people up to fail. The amount of rules that you have going with these hotels, you cannot have any guests, family included. You can check, it's basically like you're living in a halfway house. So one of the biggest issues is going to be, look at this. Look at it from this perspective. If you were a regular person, and you were living on the streets, you want your freedom. By forcing people to have to basically live in a halfway house situation, they're gonna be like, sorry, this isn't worth my damn time, and they're gonna leave. What I'm not understanding is that, like, it feels to me like with this whole mayor's initiative that you guys say you're listening to us, but like you're not taking anything we say and actually using it. There's a million things. There's the trash service, there's the bathroom services. Both are going very well right now. But especially, and again, when it comes to this 1,000 people, why are we not prioritizing vulnerable people, whether they're in congregate shelters or on streets in the tents? They should have, when you guys did this, they could have stayed longer than Friday. They could have had a list, and they should have been prioritizing people of the camp by things that are more. Put it this way, if you had offered me the room and there was the lady with the colostomy bag next to me, I'd have told you to piss off, and I would have told them to take the lady with the colostomy bag.
Yeah.
This is one of our biggest issues with this whole housing 1,000 is you guys are completely ignoring the shelters.
Sure.
And it feels like that is a big issue. And again, I ask any of you, if you can get yourself to be able to see one night of a shelter, go do it. Go try to do it. You will fully understand why none of us want to go. I'm transgender. I was not transgender when the last time I was on the streets. I came out because of, thank God, the safety of being somewhat housed. I will never, tell you this now, I will never step foot in a homeless shelter again. I will sleep in a tent on the streets before I will ever step foot in one of those shelters. So if you guys are really serious about this, that's another thing for this whole thing of sheltering. You really need to start cracking down on these shelters. They're disgusting, they're deplorable, and I'm telling you, you can keep shipping people to these hotels, but as long as also you keep up this rules and keep them feel like they're living in a halfway house, they're not going to succeed.
Sorry, I just want to, so in terms of the providers who are accepting people who are
Get rid
coming
of the
from the
Salvation
encampments,
Army.
you know, all of our providers work really hard. We are in conversation with them too. I think at the mayor's office, we don't have a conversation just with one group of people. We are, you know, responsible for representing the city. So that includes many different groups of people, hearing many different perspectives, and then bringing all of those to finding a solution. And for us, what that looks like is ensuring that when we have a provider coming online, we have the things that we're asking them to bring. So for this initiative, that includes ensuring that they're providing basic amenities on these sites. They're providing access to physical care, access to mental health services, access to substance misuse, if that's what people select into. As Anna mentioned, these are going to be low barrier options. So we are working from a housing first approach in this initiative. And then, of course, housing resources and navigation resources and case management, financial literacy and workforce development training. So those are the things that we are asking providers to come in with, but they are operating the sites. So they're also their own sets of ways that they want to work. And those are things that we, you know, that they do this work every day. So, and that's the case in our shelters too.
My question is then, if you were going to give them all the money for these, to run these shelters, why did you not, you know, maybe reach out to the community and to the advocates, the people who we know who it is? Because we would have told you straightforward, do not use the Salvation Army. Don't. They, again, that hotel I was in, the food, awful, not healthy.
Sure.
It was literally take and bake crap that was cold by the time you got it. I mean, they were hiring people who had no experience with houseless people, but you went ahead without even, like, you know, coming to us and really listening to the houseless community or the advocates who have worked with these people. Our group has made inroads with the community. MAM has made inroads, and what I'm saying is that you should have, like, because the Salvation Army, their track record is awful with these hotels. The track record is god awful. I've seen it firsthand. Whatever your stats are, they're not doing the job correctly. And again, you could have picked a better. I would have rather Colorado Coalition truthfully ran these over Salvation Army any day. But what I'm saying
going to hop in
is
with
that,
another question.
I think, I want to let Britta speak.
I just want to amplify one thing from Anna, though. I think there are serious policy implications of calling shelter housing. And 14 days in shelter is not a housed outcome. And to just hear you say we're taking a housing first approach, you're taking a housing stability approach, like going the next rung. That's what I've actually heard from Mayor Johnston, is he wants to get people the next rung on the ladder. But housing first would say, we're not going to go through temporary measures and make people go through this hoop, then that hoop, then this hoop. Housing first is taking a person and getting them in an apartment and then surrounding them with services. And I'm really truthful about those definitions, because if we start messing with that, then people aren't going to believe us on what housing first is. That said, we are in a humanitarian crisis, and I do applaud the mayor for acknowledging that we are in a humanitarian crisis and trying to do humanitarian things. And it is humanitarian to offer shelter, even sometimes when it's not great conditions. We've housed just thousands of people in apartments, but we have tens of thousands of people that need this kind of treatment, right? So you do triage. I understand that, like shelter. Last December, we sheltered 5,000 people on certain nights that were very cold And that saved lives, whether or not it was great conditions. And so I think there's a place for that. We are a partner in this effort on the outreach side. We think it's really important to have really relationally based outreach to help get people to these solutions. And so we will be supporting the mayor and the plan, but would question the change of what a housed outcome is.
I think ultimately our goal is to get people off the street. As Britta said, this is a humanitarian crisis. We have a lot to learn, but we have been in this crisis for a long time, and we have to do something about it in this city. So we are going to be in conversation with these folks. They are in this work, and they have been in this work, and we're going to keep learning together. So, yeah.
Thank you, all of you. I think I'm going to ask one more question because each question takes a long time to answer, and then we'll open it up to the audience. But one person that's not on this panel, and not for lack of trying on my part, is someone from the business community downtown. And I know that Millie talked of the city trying to balance all kinds of interests from different parties. And of course, one of those is the calls from business owners who have encampments, right in front of their restaurant, or in front of condos or wherever, that they would like help cleaning up. And I know they went back and forth about sweeps or cleanups, whatever you want to call them, but could we get a little more clarity on, how do you balance those, and what are the mayor's goals or rules about, is it from now on when there is a cleanup, everyone's going to be offered a place to sleep, at least for the week? It sounds like that didn't happen in the cleanup before for every single person, but let's talk about that a little bit.
Sure. So I keep trying to pull it all the way and then remembering it's not. The overall goal of House 1000 is to do encampment resolution through connection to an option on the housing continuum. Right now, as these folks are pointing out, that's a sheltering option. We are not there yet. We are still working to bring these options online. So on Monday, we did that at an encampment. We had a cleanup this week that was not that. And so we will be faced with situations where there's a public safety concern that as we're bringing options online, we are still going to be working to move people into them, or we won't have them. So we will, I'm not sure, Anna, you mentioned a 20 to 30 day notice. I'm aware of a 7-day notice, and we have been sticking to that. So my team is part of the teams that do work around notifying surrounding communities. For us, our guiding post is, we don't want, we have service providers who need to be aware of additional services they may need to provide. And then we do, of course, have businesses that want to know what's happening, residents that want to know what's happening. To me, and to then my team who works on this, and our counterparts in the mayor's outreach, the people who need to be first informed and most informed are the people whose homes are being disrupted. So we do not do any outreach from the public engagement team to businesses and surrounding neighbors until a 7-day notice has been posted about any encampment cleanup or resolution. So, I think in terms of letting people know about any encampment activity, that's what I would share about that.
Guys ready for questions from the audience?
Absolutely.
Okay. We do not, unfortunately, have like a roving microphone, so shout your question. If you guys can't hear it, I will repeat the question. Go ahead.
Are there any other cities in America that are doing significantly better than Denver that we can learn from? And if so, can you tell us about that?
There are several cities that have aspects that are better. I used to chair the High Cost Housing Committee for the 9 highest cost housing cities in the U.S., and we were always constantly learning from each other. But I would say the biggest things that have helped the most are in places like Houston, where they had tens of thousands of vouchers and housing resources after the hurricane, and they put those to really great use. Houston actually patterned a lot of what they did on what we did in Denver. It's just that they got a scale of housing resources that we've not ever had here. So I would say that's locally, and then I would point to Finland as another place to look.
And just piggybacking off that, the fair market rent in Houston, when a lot of this happened, was right around $800 a month versus our fair market rent, which is upwards of $1,400 a month. So it's not, they had the housing resources, they had the stock, and they had the affordability. And like, those are things that are challenges in a market like Denver.
Yes, sir.
I really appreciate, first of all, your clarifications about housing first versus just housing, and then the housing versus shelter. That's, if we could get that message out better, it would be great. I want to focus on the master leasing stuff and the fact that there's like 23,000 apartments that could potentially be onboarded. It seems to me that to get people off the street, which seems to be the priority right now, that should be a priority. And then maybe it's 4, 6 month, 8 month leases that can buy some time to do the building options that you guys want to do, the acquisition options. So what are the impediments to that, and how do landlords get in the way on this? Because, you know, obviously they know that some of the people that are going to be housing through these leases are going to need mental health help or eviction help. And does the landlord, is that an impediment you guys find to onboard more of this?
So I'll take Millie off the hook for a second, since I was previously at the City and County of Denver, and we really looked at how could we do more master leasing. In fact, the Colorado Coalition for the Homeless does quite a bit of master leasing of apartments. But what Anna points out is that the Denver Metro Apartment Association does have luxury units that are vacant, but we're still in a free market, right? And property rights. When I was in COVID-19 asking for hotel rooms, I met with like more than 60 hotel groups, and we got 8, you know? So there's just a lot of stigma, there's a lot of concern, and it's more profitable to sometimes just wait for the person that you want to rent it to than it is to accept this. But I think there's still something here, and we can find landlords who are compassionate, but we're paying as a city like $3,000 a month for crappy hotel rooms. And if you could put that towards rent, what Hand has been saying is very valid, but we need willing partners. And that's, you know, ultimately the mayor of Denver can't commandeer property. It's really got to be in partnership. And so this partnership has to be built, and that takes time.
I'll just add that I mentioned we're working on surging the housing stock through existing options and expediting options. Working on a leasing program is part of that. So that's part of the work that our team is doing, is building that out. So building on the work that Britta and her team did, identifying those landlords and figuring out a program that can support people. I think all of these folks know that when people are more spread out, ensuring that they're surrounded by wraparound services is really critical. So we're looking at what does that mean? How do we make sure that case managers are supported? How do we make sure that they can have all the supports they need, just like they would if they were in a community where they had those supports right there? So that's definitely work that we're doing. And the mayor, his goal is to make sure that we are either building or acquiring 3,000 permanently affordable units a year. So that's definitely part of this work.
Just one other quick thing on that is one thing that could really help with landlords is changing the narratives, especially with like the media. The way homeless people are portrayed is disgusting, and you only see the absolute worst of us. Like, you don't see the majority of the people who are just people who work every day, and like, so that's could be a very helpful way of doing this, is the mayor, the media, changing these narratives and stop making everyone out to look like we're all just these horrible people.
Thank you for that. And I just want to say, like, for every one person you actually see experiencing homelessness, there are 3 that you don't see. And like, the reality is to Anna's point, you're only seeing, like, that's what people love to latch onto is. And so while master leasing can be part of an overall plan, the reality is that the experience of homelessness is incredibly diverse. And we need to have diverse solutions for this really like large issue. that can meet the needs of different people on different journeys. So yes, it can be a tool, and we still have to be doing all these other things.
Lady in the pink.
So my question is, what would we be doing on a policy level to keep people from becoming houseless? Because, I understand from personal experience, I was asked to vacate my apartment so that someone else could move in because we were on 1-to-1. And so situations like this, I can see, I was lucky in having resources in order to be able to bounce back from that, but I can see a lot of other people who won't be able to make that transition. So what are we doing to get protections for people that are trying so very hard to hold on to the ones that they have?
Well, first and foremost, rent control. Rent control would fix this in a jiffy, but you know, we lost 305 last year, eviction with no representation. I mean, that right there would be a massive help, is to have an actual representation, because you're not given a lawyer when you're evicted. Most people don't even show up, so you're usually going to lose your eviction because you're not going to have the money to buy a lawyer yourself. So eviction protections, rent caps, stronger policies of things like, you know, when you're on a month-to-month lease, of not, you know, just yanking your apartment out, stronger discrimination laws. Like, you know, these are things that could keep people from being evicted. I mean, the top and number one thing that could definitely help is, let alone, it's just rent caps. Stop letting rent get so sky high that no one can afford it, because in the long run, it does nothing for no one. Because the longer your property sits vacant, that's money you're not making, and you're then complaining because there's people in tents on the streets because they have nowhere else to go.
Can I add one more thing? I think the other thing that we saw during COVID-19 pandemic is we had a significant amount of eviction prevention funding from the federal government. And we were able to prevent a significant amount of evictions because of that funding. And we need to have that amount of resources so that we can prevent it before it happens. And that's, again, it's morally, it's financially, it's ethically the right thing to do, is to just prevent homelessness before it starts.
Which, by the way, is more cost effective when it costs nearly $500,000 to build an apartment in Denver.
Yeah.
Maureen.
My name is Maureen Welch, and I am at an organization for people with disabilities, Navigating Disability Colorado. And my husband and I purchased a 40-unit apartment building with the intent of doing Section 8 housing vouchers. That's my goal, is to house people that have disabilities. And what I found is it's very, very hard as a willing landlord to work with the housing authority. And I think that's the voice that's missing there. And I actually talked to a friend of mine, an investor, to buy the fourplex next to me, so we can have 8 units next to each other. And she had no idea that it was, I had to fight with the Littleton Housing Authority, which is called South Metro Housing Options, because they told me, oh no, we can't go higher in your rent. And I said, well, I read the HUD regulations, you can. And I had to go above them to the city council to get them to actually read the HUD regulations. So they had 1,000 vouchers in 2 hours in Littleton. And then we had 26,000, I think, in there. So I think that that's a big missing piece, because they just want to build new buildings. They're a development company, and I think the housing authorities are development agencies. They're not about getting people housed. And I have a real issue with that. So I'd like the perspective of the group here, but scattered housing, okay, that's what the federal rule from the government says for people with disabilities, is you shouldn't be congregated in one area, because that's segregation. And that doesn't give you choice. But it seems like a lot of the other initiatives are all about creating segregated, concentrated, which we know from public housing in the 70s is not the answer. So that's my question, is we have a conflict here between scattered housing living in the community and having segregated big high-rises that are going to one place. So what do you all think about that?
Well, first, again, it's another thing of changing narratives. Because a lot of the problem with the landlords is these narratives that they see when, like, I know myself as somebody who has a voucher, it's a nightmare to get an apartment, because as soon as they see you got a voucher, they will come up with any crazy little thing they can to,
So he's in my unit now. I got someone off the streets in one of my units.
yeah, and yeah, and it's a nightmare. I mean, the paperwork you have to deal with, the everything. But I mean, one of the biggest issues is that there's all these narratives that, like, landlords don't want to rent these homes to people with vouchers or master leasing, because eventually the apartment's going to get trashed. It's going to get destroyed. They're going to be cooking drugs in there, which is not true. I mean, this narrative is the narratives that are in effect all about how the homeless are portrayed. They need to be changed. They just need to be changed. People need to, I could tell you now, one of the best things, go talk to some of the people in the neighborhood. But like, as long as these narratives that like keep going, we're going to constantly be discriminated against. Landlords are not going to want to rent to people with vouchers. They're not going to. Oh yeah, that too. And I mean that I can't explain myself. I'm just saying what one problem is with the voucher system is trying to get landlords to understand that not every single unit they rent is going to get trashed just because it's a voucher unit.
First off, thank you for being willing to house people. Sorry that it has been a hard experience, and it's not unique, sadly. And we have lots of rigmarole that we put around affordable housing. And one of the things that I'd like to see is fair market rents, which is what you're speaking to. Be fair and keep up in a high cost market so that we can use more scattered site. But scattered site is really how we're doing most of our affordable housing. So we've only got 26,000 units in Denver are deed restricted affordable housing. There's 1 in every 3 households that need an affordable rent. So by definition, most people are either in unaffordable housing or have found affordability through scattered site housing. And so we very much appreciate that partnership. And yes, I hear you that it can be hard, and we need to make the systems less mean and more conducive to partnership.
Guy over
sorry,
here by the wall
can
has
I-
his hand up for a long time.
Can I just add really quick?
Yep.
I've learned a lot being with these folks who do this work about all of the kind of collaboration, formal and informal, that they have, and it's really admirable, all of the resources that they have procured and built and everything that they are doing. And in the space that you're in, for folks with intellectual disabilities, we have service providers like the Brain Injury Alliance of Colorado and Atlantis Communities who have, they have things like Valor on the Facts and the places at Atlantis Communities, just to answer your question about like the different types of housing. And so I think what they would say is like providing options on a continuum of care. Just, I think, and what we want to think about too is giving people a choice, right? So I think that's something that I've learned from these guys too, is just making sure that people have a choice. So moving towards scattered sites is definitely something we want to do from our perspective, just making sure that we're providing resources and support to give people those wraparound services wherever they are, being in conversation with our service providers about what does it take to have a case manager that can get there and the other supports. If we're doing scattered site, but absolutely want to find landlords like you and your husband who want to do that work with us. So thank you. Yeah, just wanted to share that. Options is the most important thing.
John Stanley, I live up in the mountains. We have different kind of houses. This problem up there that I know seems like a first world problem, so to speak. But my hometown is Portland, Oregon, and I went back and visited and spent about 3 hours taking pictures of the street, walking the streets. Abandoned the streets of Portland. They have been taken over by the people who are living on the streets. I think we need to understand where this can go and realize, and thank you for all of you who are doing work in this area. It's super important. My challenge is, this is Jennifer, thank you so much for the Colorado Sun still stigmatizing otherwise, if that's a word, the homeless, the shelterless. And to your point, I just think you have a very, very powerful tool, and I'd like to see much more of that. I'll stop there.
I like it. It's okay.
I want to take just one more second on that and say you did a great piece on HOA foreclosures recently, a really in-depth investigation on HOA foreclosures and how the ripples of somebody's lives and story after story along with the data. And one of the narratives out there is about choice. And the more that we can show the systems and those individual stories, that kind of in-depth reporting is always appreciated.
Thank you, Britta. Back here.
What is your advice for nonprofits that aren't one-home partner agencies to advise our community members that come to us with questions about housing security and homelessness? So we're not continually sending them down dead ends. So it's more streamlined and efficient. Sometimes it seems like, they're like, well, I tried that and I tried that. There's the Denver's 3-year shelter strategy where it pulled from Houston. It seems like that they're really trying to streamline certain components of this whole process. And is there a way for us, like food banks, when our community members come to us, to give them helpful advice that doesn't send them in a dead end?
I can say, as advocates, we've been doing this for the last, especially after COVID, just everything collapsed. The information out there is god awful. I mean, for the houseless and for you guys, believe me, we work with hotels, and I'm calling food banks to help the people living in these hotels, and I'm calling numbers that don't even exist. So one thing that needs to be done, I believe, is that especially the city could be doing is working on actually having a database, a printable database of these actual things, and having an easy way where everything is right there, because it's really hard to find any services. 211 or 311, I can't remember the number, is not very helpful. You can I've gone to places like Stout Street and they give you something that's not correct, and it's not fully their fault. It's just that, there's just not enough correct information. Like I said, advocates, we've been trying. We've been picking each other's brains, being like, okay, I know this feed, I know this feed, I know this food bank, but we're small. I mean, the city especially, I think, would be great to do something like this, is reach out to the advocates and collect that information to make something that's easy for the houseless and for the people wanting to help, to be able to, keep contacts, let people know, oh, this food bank has closed. Because I can tell you now, there's nothing worse than walking up to a food bank and realizing it's not there anymore.
I would just share that I think the feeling that you just described and that you just described, Anna, is a common one for folks in both of your positions. And I got to attend a meeting with a group that was convened by the Office of the Municipal Public Defender. It's a group of peer navigators and case managers and advocates and some service providers who have come together and said, if somebody comes to you and you're not sure where to send them, where do you start? And so they're kind of in their early phases, but they're sort of pulling together, and Host is in this group as well, they're pulling together kind of an official resource list along the lines of what you're talking about, Anna, and figuring out how do we keep it updated if we have folks from so many different arenas. So I can definitely get you connected with the folks from OMP, but yeah, I think that's something that is a conversation right now, and would love to also get you connected to, because they're a group that's kind of just starting to form and figure out what their mission is, but primarily it is to help resource navigation for people who are not as connected into one home and the more kind of traditional tracks of getting folks into these services.
Thank you. Just maybe 2 more quick ones. Yes, sir, over there. Yep.
Survey that was released from, I think, some Denver University students
and just another, if you pardon my expression, crap that's being placed in the street, presumably by property owners, or is it the city? Like, but it's kind of murky. It's a little bit unknown as to like, what is this stuff? What is the legality of this? How is this reclaiming the streets for the people of Denver? And so if you just talk about like the actual streets, as our guy back here said, and how the house people seem to be abandoning them, how is this kind of infrastructure of doom being, what is the legality of that? Tell me more.
On legality, I'm not going to be the answer on that, but I think hazardous hardscape is just really awful looking. And it's not very humane, and it's also, as far as I can tell, it's very dependent on very specific things of each part of the zoning and design overlay, what's allowed or what's not, and it's probably also not the highest priority. So it's grown a lot. You're correct on that.
I think what I'm not the city attorney. I am the director of public engagement in the mayor's office. Just so legality, I'm not going to share legality, but I will share that from the work that we are doing in this initiative, we are working to eventually not have to, from what I'm aware, not have to use the fencing when an encampment is cleaned up. That is, again, our goal is to do encampment resolution through connection to a resource, right? So we're still working towards that piece. And in terms of the kind of unsightly, like the big boulders, the things that make our city, not nice to be in, I think that we do have conversations that we have to have with private, property owners about that. So it's all kind of a part of this process. Like I said, we're learning and we're working those things out as we go. Thank you for that question.
As somebody who's not a lawyer, but I can say from what I read from the report is technically it's illegal, first and foremost. It also causes major ADA problems, and the first encampment that was swept was 22nd and Stout. It was a rat infestation. That rat infestation would have never happened had those rocks never been placed, had the fences had never been placed around certain grassed abandoned areas and left to overgrown and covered in rocks, abandoned buildings. They left an area that was prime for these rodents to have homes, and then people are moving there to live there because there's nowhere else to go. So the rocks, technically, no. You're not supposed to put anything in the right-of-way without the permission of the city. We can remember, I believe it was the Church of Cannabis, had a lot of problems with just putting up a little sculpture on it. And on top of it, it looks gross, it's disgusting, and it makes our city look horrible.
Last question, right straight here.
I'll start on that. Two great questions. One, there is in the permitting office now, AHART, it's an affordable housing rapid response team that gets all of our shelters and affordable housing through all of that system and shepherds them very quickly through it. So it's a fast lane for that. So that's been a tremendous program of the last couple of years. That's just Denver. So our other question asker over here with Littleton doesn't have that same option. Not yet, but we often do things in Denver and then other places learn from that too. And then on the second question, I happen to be the CEO of one of the largest employers of the folks that you're talking about. So we have about 800 staff at the Colorado Coalition for the Homeless. And I think some of my first 6 months has been talking with funders to say, this is really hard work, this is really important work, and why can people make as much flipping a burger as dealing with complex human issues? And it takes time to shift funding and so forth. But I think if we have some really serious conversations about what does it mean to really say that human work is really important. And yes, for our educators, but also for our social workers, for our clinicians and so forth. And how do we build that capacity? Because these are the jobs we need. The Behavioral Health Administration has been ringing the bell on this, that there's just not enough clinicians and we have a mental health crisis. Like, these are all impacts that we're seeing. And so I think how we educate, how we fund, and how we have training programs that are different than a master's of social work, that will be important. But we have to get funders to allow reimbursement for non-clinical staff because it's absolutely essential. And our organization has done a really good job of that, but it's by still fighting these big fights on federal rules and so forth. And so there's a lot of things that need to be done by a functional Congress, which today it doesn't look like we have one. So we can't rely on that. We have to look at our own community, and I think it's time to talk about a regional funding source that can seriously address our capacity needs, our services needs, and our housing needs here in the Denver metro area, as well as the state of Colorado.
Also, I wanted to say is reaching out to formerly houseless people. Myself, I'm somebody would be in a position. I'm actually going to be going to school for it, but that's another very great program that I think that the state should be kind of funding, is training houseless people to become social workers. I mean, you got somebody who like knows exactly what these people are going through. Not every caseworker is bad, but the burnout's high. It's rough work. You put up with a lot, but like when you're hiring people who've already been through it, there's a set of skills that you just can't get from going to college. You can go to college, you can book learn all you want, but you don't have a certain set of skills that just people like me and other unhoused people or formerly unhoused people have. So if we're looking at, yes, funding, God, we need more funding than we've ever needed for this problem. But as for a lack of people, that is a very wonderful source pool for easing this issue.
And places like the Colorado Coalition for the Homeless value lived expertise highly and have peer roles, and people can be trained from those. But I like to say the School of Hard Knocks is a great teacher.
I would just add, I think on this panel, these folks have incredible ideas for the innovative ways. I mean, there's no lack of tenacity, creativity, and innovation. That's not what's missing in this field. I think what we're missing is resources, and they've shared plenty about that, so I don't have to add to that. I will say to your question about just having one place where we can go and like the permitting slowdowns and all of that, the state of emergency is what has helped us move some of these things faster because it convenes the emergency operations center inside the city, which is the kind of heads and key people from multiple city agencies, as well as some community partners, moving some of those things through quickly, so things that might be emails or meetings or that might take a longer time can happen every day in one concentrated place. And so that's been really key to moving things more quickly. Coming out of that, we will be working together to continue working to get people connected to these indoor options and surge the housing stock. So that's our work, that's big work, and we're really committed to it. So thanks for asking that question.
Okay, we'll wrap up with that. Thank you all so much for caring about this conversation. Thank you to our amazing panel for their robust and thoughtful answers. I'm sure you could probably catch them for a question on our walk to lunch if needed, but I really appreciate you all being here.
Can I also say one thing? Can I tell you all, I want to, what's the word I'm looking? Take the time and go out. Go out. I ask every one of you to go out, find one home, at least one houseless person, sit down and talk with them. Actually get to know them. Or maybe go home, buy a bunch of peanut butter and jelly, make some sandwiches, go out and hand them out, and genuinely talk to these people and get to know them. You'll understand that a lot of the things that are embedded in your mind about the houseless community are not true. Like, give them, they're humans. We deserve humanity as much as everyone else.
Excellent. Thank you.